If you've got one-sided lower back pain right about here and hip pain right here, when you stand too long, sit too long, and even when you train legs, you're gonna need a lacrosse ball. Lie down and place your feet on the wall. Take this ball and you're gonna place it in between your legs. You're just using it here as placement, digging those heels in, lifting just slightly and feeling it right in here. Breathe in through the nose, and then you're gonna breathe out through your mouth like you're kind of like trying to fog up a mirror. Do 2 to 3 sets of 5 full breaths. This repositions the pelvis from an anterior tilt. It activates the hamstrings to stabilize your SI joints and reduces lumbar shear. It teaches you to maintain a neutral pelvis when sitting and standing. Lay about 6 to 10 inches away from a wall. If your left side is bothering you, then you lay on the opposite side. You're gonna come down and make sure that your head is supported with your arm. The bottom leg is bent and the other one is going to be lengthened out, slightly bent. It's not going to be completely straight. Make sure that you're all on your side. So you don't want to lean forward like this. You want to make sure you're actually on your side right here. You can place your hand here for support, engage those abs. You're going to take this leg, you're going to put it on the wall, the heel, and the toes are going to be pointed down. You're going to straighten it out just a little bit. So you want it almost straight, but with a slight bend. I need to show you guys this one detail that is super important for this exercise. You need to be far enough away from the wall to where your top foot actually goes past your glute. So it needs to be behind you. Take that heel and push it into the wall and squeeze. You should be feeling that in your glutes and your hamstrings, not at all in your lower back. And you're gonna hold this for about 5 seconds. Repeat this about 8 to 10 times. Do 2 sets of them and hold with that 5-second hold. The heel press into the wall with mild internal rotation actually activates the glute medius. This is the key stabilizer for the pelvis. This builds frontal plane pelvic control and offloads the SI joint and calms the TFL and QL. Now we're gonna integrate new pelvic stability with movement patterns. For this, you're gonna need either a kettlebell or a dumbbell. Stand with your back straight, not rotating your pelvis, nice and neutral and straight. Your foot placement is gonna be your natural stance. When you lift up the weight, you're gonna bring it shoulder height. Your elbow should be close to your side. You're gonna bring the weight up and you're gonna have that palm facing towards your midline. Your wrist is straight. You do not want it to do this or this. As you take those 20 to 30 steps, you're gonna make sure that there's no wobbling going on, your torso is straight, your back is straight. Do 2 to 3 sets of 20 to 30 steps. This movement directly stabilizes the SI joint when doing things like walking, lifting, and daily tasks. It activates that glute medius, deep obliques, improving pelvic alignment and control. And because of this, it reduces over-reliance of the QL and TFL. It retrains your core and your glutes to stabilize your pelvis dynamically.